Hello, welcome to VMC. I'm Dr. M. Today we are going to be viewing a video that I've never seen before, but I was told about it on Twitter. So this video is by Dr. Mike. I have not watched their channel before. I don't know anything about them. It appears that they have over 10 million subscribers, and it looks like they do a fair amount of like general human medical stuff. They react to memes and view TV shows. This video that we're going to react to today is titled, "My Husky Lost Her Leg But Shouldn't Have." It sounds like it might have been a difficult situation. Okay, so here we can see the opening to the video. It's posted the 21st of September. Let's start watching and see what happened.
Who don't know, this is Roxy, my husky. She's the OG rock star that helped me launch my social media career.
He has more than 2 million.
So it looks like Dr. Mike became popular on Instagram in 2015.
Followers on Instagram. Talk about a fan club.
Okay.
Today,
Oh, she
I wanna
looks
share
so
a
much
very
younger
important
there.
story of something
She
that
looks like a
happened with
teenager.
Roxy. It's a terrible situation. As you can tell, she's now a tripod, a three-legged dog, and she's doing well, but this situation could have been avoided, and I want to arm you with information that you should know when you have to make a choice when your pet gets sick.
Okay, well, maybe it could have been avoided. It does look like the dog is pretty comfortable, and that's good to see. Let's see how she's learning how to walk as a tripod. Oh, good dog.
So to set up the story,
You can see the dog doesn't like being petted this way. Look at the tension in the eyebrows, and you can see this whale eye here. Please don't do this to your dogs. I mean, very few dogs are going to like that.
Roxy now lives with my dad, so he takes care of her vet stuff, takes her in for checkups, and Roxy had sort of a bump growing on her right arm. And this bump was there for several years.
Okay, hold on here. Anytime you notice a mass that has appeared on your pet, it must have a proper medical workup as long as it meets the criteria for doing so. And those criteria are that it's been present for more than a month and or it's bigger than a pea in size. So you should be checking over your dogs, and anytime you notice a mass like that, make sure to see your veterinarian and absolutely make certain that we are doing tests called a fine needle aspirate, where you take a needle and you take some cells from the mass and then you send that sample on a slide to look at under the microscope, and you send it to a pathologist. Some veterinarians will look at it in clinic, but there's a lot of times where as general practitioners, we can't tell enough information. So then we send it to a veterinary pathologist and they will send us a report back. And based off that information, if the mass does come back as something that's generally benign, often with those, we monitor them and leave them be unless they're causing the pet some concern. However, if we get other cells back, like a sarcoma or like a mast cell or any number of different tumor types that you can see, then we end up removing the mass. And the earlier you do that and the smaller you do that, the better it's going to be for the pet. So the fact that he's saying here that they knew this mass was there for years and years and they've just been watching it is a huge problem, especially since he's a physician. I would hope that he would have known to bring this up to his veterinarian, and I would also have hoped that on the yearly physical exam that he should be bringing this dog in for, or his dad, it sounds like the dog lives with his dad now, that the veterinarian would have said at those physical exams, hey, we need to check out this mass here. But it doesn't sound like that happened, and that's a problem.
It may have grown slightly over the course of those years, but this bump never bothered her, so I wasn't too concerned about it. But my dad said, you know what, I'm gonna point it out to the vet on the upcoming visit, which I thought was a very good idea. So when they went to go get this bump checked out and an overall physical, they said, for 12 years old, this dog is doing very well, in good health, running all the time. She's so fit, she's so active. She looks like an 8-year-old dog. But they said, we want to take a sample of the bump on her leg.
Yeah.
and send it for cytology.
Yeah.
Which means that under a microscope, they look at and see what cells
Exactly.
are there to decide, is this a cancerous lump, non-cancerous lump, etc. So after my dad went, he gave my phone number for the vet to call back. And then when the vet ended up calling me back, they said that, unfortunately, the cytology came back and it looks like this is a cancerous bump. They called it a sarcoma, which means that it's a soft tissue cancer. And they recommended bringing the dog back in for a consultation with the surgeon.
That's sound advice. When we take a small sample using a needle from a tumor, like they did with this cytology, we don't always get a definitive answer because you're only looking at a few cells. So the fact that they got this information and that they sent it away for pathology is a really good workup on the veterinarian's part.
I know how surgery is difficult on humans, and I can only imagine how difficult it is on dogs, who need activity in order to stay fit, in order to stay mentally well, especially dogs like Roxy. She's so active, she's a husky, she has so much energy in her. So I told my dad a list of questions that I wanted him to ask the surgeon. And those questions are questions that you should always ask before going in for a procedure. A, is this type of cancer that Roxy has dangerous in that is it likely to spread? Is it likely to cause problems elsewhere in her body? What's the 5-year survival rate?
She probably doesn't have a 5-year survival rate as a large breed 12-year-old dog, but like asking these general sorts of questions are good. Sometimes until we have the full report back on the full mass removal, we might not know. But certainly, you can ask. Yeah, it never hurts to ask.
What impact will this have on her life as a 12-year-old dog? Is it worth for a 12-year-old husky to go for a surgery on her leg to remove a tumor that so far has yet to cause a problem? And I thought my dad, being a physician, would be well-armed to ask these questions, and I trusted him to do so. I actually don't talk to him the following day when he actually went for the visit. And the next day, he sends me a picture of Roxy wearing a cast, healing up in the sun in the backyard.
Ooh. That is quite an extensive bandage. So from this, I'm imagining that this mass was actually pretty high up on this leg, and you have to bandage past that because otherwise you can get swelling in the toes and cause problem to the distal or further down part of the limb. So if the mass was, say, up here, you would have to bandage from the toes all the way up past where that incision was. I mean, it looks like it's a pretty nice bandage. This looks like an appropriately sized cone to prevent her from chewing at this bandage. She does look like she's maybe on some pain management, which is a good thing. We want pain to be well controlled. That's great.
I thought, oh wow, she must be doing so much better because she's healing. And he goes, she's doing awesome post-op. The doctor told me that it wouldn't be that big of a procedure and that they could likely do this, in and out, 1 day's time. And they thought it was beneficial.
Most mass removals are going to be that. Sometimes they can be in a location that's a lot trickier, or they can be they can extend a lot deeper than, say, if they're just in like superficial skin. If it goes way deep into the muscle, then it could cause a lot more difficulty with surgery and post-op recovery. But a lot of mass removals, especially if you do them when they are very small and when you first notice them, that's going to greatly improve the likelihood of this being a simple surgery and a simple recovery. Yes.
I was a little bit skeptical, but seeing the fact that she was recovering was very promising to me. So
I don't understand why he's skeptical. That doesn't make sense to me, but maybe he'll explain.
Over the next few days, things started to change. She had to go in for multiple wound checks to get her wound examined because the area where she had the tumor, she had a very thick bandage on. My dad couldn't check it himself. There was sutures in place, staples in place, and they needed to constantly check this. So she was on antibiotics. They were doing these checks. That's
also very normal and should happen. Yes. Like if if the bandage is necessary to keep swelling down in the leg, or if the mass was so big that the skin couldn't fully close after it was properly removed, then yes, you're going to have some wound healing that also needs to occur, and regular checks of that is crucial in the post-op period. Yes, absolutely.
I noticed that the bandage was on really tight, but you know, I'm looking at pictures and I'm trusting my dad and all this stuff. And then like a week goes by and my dad calls me while I'm working in the hospital and says, Mike, like, I need you to come home after the hospital and look at Roxy's leg. I don't think it's good. And I'm like, but wait, like, I'm not a surgeon, A, I'm not a vet, B. If you think it's bad, then that means probably we should go get it checked out at the vet. And he was like, no, I have an appointment with him like in 2 days. I'm gonna go then. That's when the surgeon is there because he's on vacation. There's some complicated things. Like, okay, of course I'll come by. So when I came by, I'm looking at Roxy's foot. It was now unwrapped. And this is a graphic photo, but I'm gonna show it. Her foot was dead. Her paw was dead. Like, there was no blood flow. It was a cold foot. It smelled gangrenous, which means it was becoming infected. I was like, Dad, like.
Yeah, so you can see where the mass would have been there. So above the wrist, like halfway up the forearm, if we're using human terms. That looks very painful, and absolutely that should be examined. Like, as soon as you notice anything going slightly abnormally, have it checked out. It's so much better to be safe than sorry. And certainly if a wound ever looked like this, please do not wait another 2 days. Like, this is an emergency situation. If your vet clinic isn't open or the surgeon isn't in, you'll need to see an emergency clinic for some care. Ugh, poor dog.
This is terrible. She's gonna lose her foot. Like, there's no, like, this foot has clearly not had circulation for a long period of time. And for me, what I wasn't sure of, was this an issue of the bandage being very tight? Or was this more of an issue surgically, that when they removed the tumor, they also took out extra tissue and possibly the blood vessels that go down to her foot?
So what he's wondering is very valid. Whenever you remove a tumor, there are standard recommendations for the margin that you take around the actual mass, because if you don't remove the entire thing on the first surgery, the odds of cure reduce significantly. So it's very important that you are appropriately aggressive during the initial mass removal in order to give the animal the best chance. On limbs where there isn't a lot of extra tissue around, this can make the surgery have more complications, and it can be a very tricky procedure.
And my dad like never clarified this with the surgeon, Roxy. So I was very like upset about that and wondering the whole time, A, should have Roxy have gotten the surgery? B, did the surgeon make a mistake? C, was the bandage on too tight? And honestly, it's really hard to know, so that when my dad actually went in there, they basically said, yeah, look, we think we should amputate. And my dad let me speak to the surgeon. And I asked the surgeon very frankly, like, look, is this a mess up? Did we take out too much, you know, tissue that the blood vessel came out along with it? Because if you take out the arteries and the blood vessels that are higher in the leg, they essentially feed circulation to the bottom of the paw. It would never heal the bottom of the paw then. Or was it that the bandage was on too tight in the rehab process? Or is she an older dog and this is a normal complication that happens time to time?
I mean, all his questions are very fair, and certainly with any surgery, there's always risk, and it's only ever recommended to do the surgery when those risks are outweighed by the potential benefits. You know, we never want complications to happen, but they happen in medicine for people and for animals. That is a part of the challenge of veterinary medicine and human medicine, absolutely.
And he basically said all of the above. And while I appreciate the honesty, because he said, look, we had to take out a lot of tissue, the tumor was larger than we expected, I think like if I was working with a human surgeon, I think that we would have thought about those risks, that if we open up or are potentially getting ready to open up a person's body, and then we see that we can cause more damage than actually benefit by doing a biopsy or removing a tumor, we actually don't do it. So I asked the surgeon, like, what was the dog's staging of the cancer? And it was a stage 1 sarcoma. And not to say that this isn't serious, it's just that at 12 years old, Roxy's life expectancy is maybe another 2 years. She's getting in that range.
Yeah,
It's
that's
sad to
probably
say,
fair.
obviously. But, you know, we're really hurting her quality of life by putting her under the stress of that surgery, plus the risk of things going wrong, like right now. So poor Roxy, in recovering from the surgery, was barely able to walk, was very sick during that time.
To be fair, I would not expect a dog that has had a limb amputation to walk immediately after surgery. Like, we need them to rest and take it a little bit easy. And it does take them some time to figure out the new mechanics of how to ambulate, just like it would for people. So I wouldn't expect a dog immediately post-op to be feeling super fantastic. Like, I mean, I'm going through this with my own dog and her elbow surgery at the minute. You know, we're a week and a half into recovery and she still does not ambulate very well. And this was a lot less invasive of a procedure than what this dog has been through. And also my dog is 3.5 years old, not 12. Yeah, so like I understand very much why Dr. Mike is upset here. This is a very upsetting thing to be going through. Well, let's see what happened next.
And then now we're saying we have to amputate her entire leg.
Sorry, I guess I misunderstood. So he was saying immediately after the mass removal that the dog wasn't moving very well.
And not just the entire leg, the scapula as well, because apparently in dogs this is the way to do it.
Oh yeah, okay. So, and what they've done here, removing the scapula, is absolutely the way that we go with the vast majority of front limb amputations, and that's how it should be, because the dog already weight bears about 60% on the front limbs and about 40% on the back. And so we don't want that weight of that scapula that's not helping with anything to be there. And so removing it is the right call. And also, as they don't have that limb anymore, there are some ridges to the scapula, and as the muscle that usually sits on either side of those ridges goes away because they're not using the leg that's not there, then that can cause some pressure sores on the scapula if you leave it. So what he was told is absolutely correct. Removing it is appropriate, and it's good to see that she had a fentanyl patch and she had some good pain management there. The incision closing looks very good. Like, it looks like they did a lovely job with the amputation. I'm sad that she had complications post-op and ended up with this amputation, but you know, it looks like he's getting very good care for this dog.
I asked about a prosthetic, but he said that that would require a second operation as well, and she would have to learn to use it. And an older dog, and being a husky, which is a breed that tends to be more picky with pain, he said that she might not even adapt well to it. He recommended just taking off the entire leg.
Absolutely. I 100% agree with everything that was there. I mean, obviously I haven't examined this specific dog, but the general facts that Dr. Mike is relaying right now are absolutely true. We usually don't do prosthetics for our pets. There are some specific situations where we do, but a lot of the time, if it is one limb that's being affected, the animal does really well without that limb.
And kind of told me some new information that I didn't know about dogs, that they tend to handle amputations better than humans.
True.
Because they don't have the psychological traumatic component of this.
Yeah.
Where they don't miss having the fourth leg. That, you know, she's like, okay, I have 3 legs, this is what I do, and that's who I am, and that's the dog I am, and I move forward. Can I get a high five? Or is that messed up task? Oh, good girl!
Yeah, maybe don't ask that, because in order for her to do that, that means she's gonna fall. Like, don't do that. That is messed up to ask. Your dog is so sweet that she tried so hard. Ask her for a nose touch, ask her to sit, ask her to lay down. I mean, don't ask. Anyway, all right. Let's keep going.
And because of that, they seem to rebound quite well.
True.
I will say out of this whole process, that's probably been the most accurate part of it. that Roxy has recovered quite well, thank God.
Yeah, they usually
She
do.
had a mean scar, you can't really see it now, but it's healed up quite well. We took out the staples a few weeks ago.
Oh,
She's now going for longer walks with my dad.
she's
When I
so
come
sweet.
home, she's wagging her tail. She's still
Yay.
shedding like a monster, as you can tell from all my clothes. She's still super sweet. She's happy, obviously slightly lower energy because she fatigues. And now I know she has higher risks of getting arthritis in her legs because she's unbalanced. She has to put...
Yeah, especially the wrist of that other front leg, the carpus, will now be taking a lot more strain and weight. If this were my dog, I would be very closely working with a veterinary rehab specialist in order to make sure that we get her mechanics as good as we possibly can and to help to protect the carpus on that left forelimb. Because that's the joint that's going to be most at risk, yeah.
More stress on each one of the joints, yeah. It's sad. It's sad watching, you know, your dog get sick with whatever condition it is.
Very true. I'm currently in the middle of it with my own dog. It's exhausting and it is very emotional. And it's tough because we can't explain stuff to them.
So all in all, this goes to say, you know, when you bring your dog to the vet, make sure you're armed with good information. Make sure you ask hard questions of both, not only the general vet, but the surgeon. Make sure they give you accurate risk assessments, because it's very easy to say, oh, we'll just take this out, easy peasy, no problem. But then, like, your dog can lose a limb and it could be quite frustrating.
But I mean, that could happen with any species. Like, unfortunately, sometimes bad things happen. That's just part of medicine. And what it sounds like here is that this tumor was actually a lot more invasive than was expected. The way we are taught is to be as aggressive as possible when removing the mass the first time, otherwise you risk not getting all of it. Now, of course, that comes with its own risks. Like you just sometimes don't know all the information until you're in the middle of it. And that's tough. And I'm very glad that this veterinary surgeon was very straightforward with Dr. Mike. It's not easy to have these conversations, and we absolutely hate when complications happen. But that's still, I mean, anytime something happens, it's a grieving process, it's a challenge, it's no fun for anyone.
Because it feels like you didn't get all the information. But know that pets are sadly not immortal, and you want to think about their quality of life just as importantly as you do the length of their life. So
absolutely, and I say that over and over and over again in so many videos on this channel. It is all about the quality of life. So please monitor your pet's quality of life. I'll link some quality of life assessment tools in the video description so that if you're not already doing that, you can. And veterinary medicine as a whole focuses much more on quality of life than quantity, especially when I compare it to human medicine. So we do change the approach with our pets exactly for the reason he's saying. It's because we are all about that quality of life.
Hopefully Roxy continues to be a little rock star that she is. She loves her treat.
Yeah.
And I'm really glad that, you know, this terrible situation kind of had not the worst ending.
I'm so sorry that they went through that. What a difficult situation. And if I was going to pull any nuggets of information for you from this, there are kind of two main ones that popped out to me. The first would be what I talked about in the Being a Unicorn client video. The people that have the questions and the concerns really need to be at these appointments. You know, there may have been some loss of communication going from the veterinary team through people to Dr. Mike, and I wonder if Dr. Mike might have some different feelings about everything if they'd been able to ask the questions themselves over the phone or in person at the original appointments. It really does help to have very clear communication from the get-go. And the second really huge important nugget here is that as soon as tumors, masses are noticed, you absolutely need to get them investigated. The smaller they are, the easier the removal is, the easier the recovery is, the cheaper the procedure is. However, now that she has her 3 legs and she appears to be recovering really well, I'm happy to see her looking so comfortable. She doesn't appear to have a lot of pain at this point. I hope that Dr. Mike will start working with a veterinary rehab team in order to support especially that left thoracic limb that's now going to be taking more of a load. And I hope that she has a wonderful amount of good quality of life remaining for her. And I hope that you have learned something from going through this with me. I do put out a new video most Fridays, so I shall see you in the next one. Take care. Bye.